Aetna is both UPMC and Allegheny Health Network are actually a part of the Aetna network, so you would be able to use both those providers with your Aetna insurance, or use both those hospital systems with your Aetna insurance, rather. So first, before we get to the plan highlights, I put together this chart, and it just goes over where to go for care. It's kind of like a guidance system. So for anything minor, for the first three columns, so we have the informed health line, which I'm going to go over a little bit more later in the presentation, but it's a nurse hotline that you would be able to use free of charge if it's like late at night or the weekend or anything like that, and you can't get a hold of your primary care physician. The nurse line would be a viable outlet for you all. Also, the CVS Minute Clinic. So to you all, there's actually no cost for using the Minute Clinic. So that would be a good resource to use if, again, primary care is not available. Obviously, also, you don't have to use a CVS Minute Clinic. You could use any kind of walk-in clinic as long as you want to just make sure that they are participating with your plan. And then for urgent care setting, this is getting into a situation where you're kind of waiting a long time just because of the amount of the volume of people that are using those services. And then at the bottom, you can also see, so the first, where it says average cost of visit. So the first number is just the average cost that it would be for like the plan to pay. But then also it shows what you would pay. So for instance, like the walk-in clinic, it's $10 copay. For the urgent care, it's $20 copay. And then an emergency room, and this is going to be where you're waiting the most amount of time also, and you're paying the most amount of money. And my rule of thumb for emergency rooms is unless it's like life or limb threatening, usually there's another outlet that you could use to get the care that you need. So I just wanted to put this on here just so you all see just the different outlets that you have to receive the care that you need. So the first up would be, excuse the date on that one. So the firefighter plan, so with them, there is the Premier plan and then the active plan as well. So we're going to go over the Premier plan first. With that, the deductible for that one is $100. For in-network, out-of-network is $300. For the family, it's $300. For in-network, for out-of-network, it's $900. The total max out-of-pocket, so this, I like to think of it this way. So the total max out-of-pocket would just be worst case scenario, how much you would be responsible to pay. So the max out-of-pocket for both plans is $7,150. For the family, it's $14,300. Out-of-network does not have any kind of out-of-pocket max. So if you do use your out-of-network services, you would be responsible for those charges for the whole time that you're using the out-of-network provider. Preventative care on both plans is covered at 100%. And then just going into doctor's visits, so it's $15 copay for the Premier. For specialists, it's also a $15 copay, and also walk-in clinic on the Premier, it's a $15 copay. For the active plan, for the deductible, there is no deductible on the active plan. For out-of-network services, there is a $300 deductible. For the family, same thing, no deductible, but for out-of-network, there's a $600 deductible. As I said before, the out-of-network amounts, or for the out-of-pocket amounts, rather, are the same on both policies. Doctor visit on this one is a $10 copay, and then $20 copay for specialists, and walk-in clinic is a $10 copay as well. For police, so for this, they also follow a similar path, similar plan path rather. So there's a Premier plan for the police officers and also the active plan. And again, the deductibles and the copays are similar on those. So for the meat and potatoes of what I want to focus on though, we're going to go over the municipal plans. So we can start with the 90/10 plan first. For the deductible for a single employee, there is none on the 90/10. For the family, also none. For the out-of-pocket max, it's $7,150. For the family, it's $14,300. For preventative care, it's covered at 100% on this policy as well. A doctor visit on this would be a $10 copay. Specialist would be a $20 copay. Walk-in clinic is a $10 copay. And then urgent care is a $20 copay. Emergency rooms a 90% co-insurance after the $50 copay. So with that, with co-insurance, it's a cost share, basically. So you would be responsible for a percentage and the plan would pay a percentage. So on this, the plan would pay 90% of the charges after the $50 copay, and you would be responsible for those additional 10% of charges. And it follows similar for hospital inpatient and outpatient. So it would be the 90% co-insurance, no deductible on that. So you would just be responsible for 10% of those charges if you are inpatient or outpatient. And then on the 80/20, so for in-network, there is a $500 employee deductible for a single. For the family, it would be $1,000. For the out-of-pocket, it is $2,000 on the 80/20, and then $4,000 for out-of-network. And then for the family, it's $4,000 and $8,000 for out-of-network. Preventative care also covered at 100%, like it is for every other plan. For a doctor visit, it'd be a $25 copay. For a specialist visit, a $45 copay. Walk-in clinic would be a $25 copay, except for, as I mentioned previously, for CVS mini clinics. So those are $0 copay for you. All on all of the plans. Also, this is not as specific to any one of the plans that the city offers. So urgent care is $50 copay. Emergency room is 80% co-insurance after a $250 copay. And then hospital inpatient is 80% co-insurance. And then outpatient is also 80% co-insurance. So you would be responsible for the additional 20% of charges after that 80% coverage. Pharmacy plan, so no changes as well on this either. So for generic drugs, on the Premier for firefighters, it's 10% copay, so it's a $7 max on that. We do offer mail order, so that would be up to a 90-day supply of any kind of prescription. So for a mail order for like a generic drug, like if you have to take a drug for high blood pressure or something like that, and you're taking a generic, it would be a $14, and then you would get a 90-day supply of that prescription. For the preferred brands, it's a 15% copay, up to a $15 max. Same thing for mail order, it's 2 times the amount, so it'd be $30. And then non-preferred brand is a 20% copay, up to a $40 max. For mail order, it'd be the same thing, it would be $40 as well. For specialty drug, it would just be the applicable costs noted above for the generic or the brand. On the active, they follow similar prices for the benefits, but for the non-preferred brand, it's a $40 copay, and then 2 times that for the mail order, so it would be $80 in total on active plan. Police would follow a similar route as the firefighters for the Premier and the active. And then for the municipal plan, so for the 90/10, so this would be a $7 copay. For the preferred brand, it would be a $15 copay. Non-preferred would be a $40 copay. And then same thing for the 80/20, it would be a $10 copay. The multiplier on this is a little bit different, so it would be 2.5 times that for mail order. And then preferred would be a $30 copay, 2.5 times that for the mail order, and then a $50 copay for non-preferred, 2.5 times that for mail order drugs. So the first additional benefit, so when you call into the number that's on the back of your ID card, you would get an Aetna concierge. So an Aetna concierge helps you with whatever you need. So they're available through the number, again, on the back of your ID card. They connect you to available programs, tools, and resources to provide you with the right solutions at the right times. So care team representatives stand by to explain benefits, answer benefit questions, and they can actually kind of walk you through any kind of tools that you might need to assistance with, rather. So if you're on like the member website or something and there's a question, they would be able to assist you with that. So it gives like a little example. So imagine you call to ask about your maternity benefits. After you answering the benefit questions, the concierge gets a system alert that a maternity nurse has been trying to reach you. So the concierge takes action and immediately connects you with the nurse to help ensure that you have a healthy pregnancy and baby. They can even connect you with your employee assistance program, so like EAP, to assist with any kind of work-life balance as well. The next thing I wanted to talk about was the Aetna mobile app. So the mobile app has a ton of different features on it. There's the Find a Doctor feature. So if you go onto the mobile app, you log into your account. You can use the Find a Doctor, just type in your zip code. It'll bring up all the providers that take your health plan specifically, as long as you sign into your account. You can access your digital ID card on there. That's probably what I use it for the most, because whenever I go to the doctor, I just show them my phone, which has a picture of the ID card that they can get the information from. You can get cost of care on there as well. So if you're scheduled to have like a knee surgery or something like that, you would be able to go on to the cost of care tool and then get an estimate of what that would be applicable to how your benefits are set up, as long as you sign into the member website. And then you just access it by just going to Aetna.com, or on the mobile app, you would just go to the App Store and type in Aetna, and it's the first one that comes up. Something else I want to talk about was just the discount programs that are offered. So this isn't any sort of like benefit or anything, but there are discounts that providers would accept, or give you rather, just for having Aetna insurance. So there's discounts on fitness, there's discounts on any kind of like nutritional books, or like natural products and services. So some of them, I wanted to go over some of the natural products and services. So they're through a company called Choose Healthy. So Choose Healthy offers a 25% discount on specialty healthcare services for more than 66,000 participating providers nationwide. In addition, you can save up to 57% on a variety of popular products from the health and fitness vendors. Some of the services that they offered on there are like therapeutic massages, acupuncture, nutritional services, as I mentioned before. They have access to, you can get your vitamins possibly from them, and then at-home yoga products as well. So there's also weight management assistance through LifeMart. So LifeMart is a member discount program that offers a range of savings and products and services, from discounted prices to free gifts and coupons. So there's discounts on like meal plans, meal kits, wearable fitness devices, workout equipment, scales, gym membership, and virtual fitness programs. So you can access all of that information, like additional information rather, on the Aetna member website, if you just go under discounts and services once you are logged into the website and or app. Something else I wanted to touch on is the Aetna Enhanced Maternity Program. So this program supports all women throughout their experience, whether they have risk factors or not. So you don't have to be at a high-risk pregnancy to actually use this feature. So program features include a fertility advocate. So that'll be like your care manager. They provide support if you're facing infertility, predictive data to help us identify pregnancies early on so we can provide timely, more responsive outreach to you. And then also there's guided genetic counseling, or genetic rather, sorry, counseling and screening services baked or backed by medical expertise. Education and resources to help you close any kind of gaps in care that you might be finding. So definitely a great program to use. And you can, if you call into the customer service line, they'll be able to set you up if you are expecting a baby. So this 24-hour nurse line slide is what I was just referring to earlier in the Informed Health line. So this is just a great tool to use. Again, if it's like the weekend, your primary care is not open, it's late at night, a nurse, and you're not feeling the best, or you don't know if you do need medical attention, you would be able to call the 24-hour nurse line. It is on the back of your ID card as well. And a representative would be able to help you out and kind of just guide you of what next steps would be for yourself or your kid or anything like that. The next one is a slide about Teledoc. So Teledoc, I'm sure post-pandemic, everybody has kind of familiarized themselves with virtual primary care or virtual care from your doctor. So this would be the same thing as that. Teledoc is a great source. I use it frequently, actually. So it's just everyday care, 24/7, help diagnose and treat non-emergency conditions, including the flu, sinus infections, sore throats, things of that nature. You can also use it for behavioral health services. So you can speak with a therapist, and also this one is new, but they're expanding into any kind of like dermatological visits that you might have. So you can speak with dermatologists as well, all from your phone. So you don't have to leave your house. So it's a really good tool to use. I like it a lot as well. So this slide is in regards to the CVS Minute Clinic that I was talking about earlier. So with the city's plans, you would be able to use a Minute Clinic or a CVS Health Hub, which is just a more expanded Minute Clinic, offers more services, and the next slide talks about them a little bit. But with the plan, this would be a $0 copay to you. So you'd be able to either walk into the CVS Minute Clinic or you can schedule an appointment online. But it's a great tool to use rather than having to like go to the emergency room or urgent care if you can't get in to see your doctor. And then this one is about CVS Health Hubs. So as I said before, these are just expanded Minute Clinics. They offer a larger variety of services. So some of them, to name a few. So you can get support managing certain chronic conditions like sleep apnea, high cholesterol, diabetic services, lifestyle support for heart health, pelvic exams, STI testing, colorectal risk assessment, chickenpox vaccines, so you can get any kind of vaccines that you might need as well. And then this is just, I took this from our website. So within a 20-mile radius of Pittsburgh, there's actually 36 CVS pharmacies. There's 8 Minute Clinics, and then also 8 of those locations are actually a health hub. So again, just that more expanded service offering at the health hubs. The next part is just about resources and contacts. So this is the Aetna member service number for medical, pharmacy, EAP, and then a link to the Aetna member website at the bottom. And next part is just Q&A. Does anybody have any questions on anything? I can't actually see the chat, I don't think. Oh, yes, I can.
Cameron, how new are the health hubs? I've seen them. I didn't know that they did all those things. Are they super new?
Yeah, so they're we've been, I'd say for the last 4 years, we've been kind of perfecting the model. So they're not super new, but I mean, if you think about it, the world shut down for like 2 years because of COVID. So in theory, they're only like 2 years old.
Which ones are in Pittsburgh? I know you said 8, but do you know particular ones? Just offhand? Probably not.
No, but I can actually, no, I don't know the locations, but I can actually get that to you.
Yeah, can you get that to me? I'd like to post that on our website as well. As this stuff.
Definitely.
Thank you. If nobody has any questions, we will end this session. If you do happen to have questions, you can always email myself or anyone in the benefits office, and we'd be happy to help. We can also get you to Cameron if you need to. Other than that, you will receive the Mojo points for your participation today as well. So you'll see those in your Mojo or your wellness accounts in about a week. So we will get points to everyone that participates. And that's for this and all of the events. You will see them under wellness pop-up events. So if you have any questions, please give us a call. Otherwise, thank you so much for participating. Thank you, Cameron. I appreciate your help.
Thank you, Cameron.
Thanks, Reese.
Thank you. See you later.
Have a good one.
Hey,
bye-bye.
All right, bye. Bye.